Southerland, and I'm a researcher at the George Washington University. And today I'm going to be talking about estimating the health impacts of air pollution using satellite-derived concentrations. So satellite data allows us to estimate ground level concentrations at increasingly finer resolutions. These high resolution pollution estimates can then be used to estimate the health impacts and what neighborhoods within cities might be at a higher risk of disease and mortality that's associated with exposure to air pollution. So in this study, we wanted to estimate the health impacts of air pollution at the local level. And to do this, we look at Oakland, California within the Bay Area as a case study. So until recently, these type of health impact assessments have been reported at the global, country, or county level. But this type of reporting can mask potential spatial heterogeneity at the local level. So in this study, we vary the pollution sources and rates of disease in order to see how our health impacts vary when we use these varying concentration sources. We hope that this type of information can inform actions that cities can take action to reduce disparities in the health risks attributable to air pollution. Next. So in order to do this, we use what's called a health impact function that's derived from epidemiology studies. And these look at linking the health outcomes of association to air pollution. So the attributable fraction of disease is the portion of disease that can be thought of or can be described as resulting from a particular risk factor or exposure, in this case, air pollution. So here I'm going to be talking mostly about mortality related to air pollution, but we also looked at cardiovascular mortality, asthma emergency room visits, and new cases of asthma. Sorry, guys, it's a lot of pressure. Okay, so from these epidemiological studies, we're able to derive a risk estimate that quantitatively assesses the relationship between a health outcome and what we would expect for each health outcome increase in concentration. So in order to apply this spatially, we actually need a couple more concentration input or data inputs. First, we need the population of our population of interest and the spatial distribution of that population. We also need the baseline disease rates or baseline mortality of that population and the spatial distribution of that baseline disease rate. And then we also need to know the pollution concentrations and the spatial distribution of our pollution concentrations. So in this study, we used concentrations from three sources. Fine particulate matter from a satellite-derived model, nitrogen dioxide from two data sources. First, a land use regression model that incorporated satellite tropospheric column estimates of nitrogen oxides, and nitrogen dioxide from an innovative mobile monitoring data set wherein Google Street View cars took measurements of nitrogen dioxide. The result of this calculation is the number of cases that we can expect within a population that can be attributed to air pollution. So long-term exposure to fine particulate matter is associated with increased risk of mortality, and it contributes a large burden of death and disability in the US and globally. So for our fine particulate matter data set, we used a satellite-derived model that was originally developed at Harvard University. This data set provided daily estimates of fine particulate matter at the 1 kilometer resolution in the United States. So this was a satellite-derived model. It was a neural network hybrid model that incorporated aerosol optical depth from the moderate resolution imaging spectroradiometer on the Earth observing satellite. It also incorporated a 3D chemical transport model, central site monitoring data, and numerous other meteorological and land use variables. The result is that we can see the estimates show that within the Bay Area, the daily maximum concentrations for fine particulate matter regularly exceeded the US Environmental Protection Agency's daily threshold of 35 micrograms per meter cubed. So our second concentration of interest is nitrogen dioxide. And nitrogen dioxide is a traffic-related air pollutant, exposure to which has been associated with increased asthma incidence and increased mortality. So we wanted to compare how two varying NO2 concentration data sets influenced our health impact estimates. So for our first model for NO2, we used a land use regression model. And land use regression basically just takes land use characteristics and other model inputs to estimate data where we don't have measured concentrations. So this particular model, developed at Oregon State University, incorporated satellite tropospheric column estimates of nitrogen oxides from the SCMACHI instrument and the GOMI-2 instrument. The researchers found that the satellite column concentrations and measures of road density were the largest contributors to NO2 ground level concentrations. So in order to compare our land use regression estimates, we wanted to use measured data of NO2. And for this, we used an innovative mobile monitoring technique wherein Google Street View cars took repeated 30-meter road segment measurements of NO2 in neighborhoods throughout the Bay Area. And for Oakland, this is Oakland, California, this resulted in over 3 million data points, which was then aggregated to an annual average, and then we aggregate it to 100 meters here. The Google Street View datasets concentrations found peak concentrations near roadways. And what we can also see is that when we compare the land use regression to the Google Street View, the land use regression had a higher median concentration of values, but the Google Street View concentrations had a larger range of values owing to those peak concentrations near roadways. So we hypothesized that this highly resolved spatial data near roadways, in combination with highly resolved baseline disease rates, would allow us to identify disparities in the health burden attributable to air pollution within cities. So the other portion of our project was to look at how baseline disease rates influence the risks attributable to air pollution within cities. So county baseline disease rates are pretty easy to obtain, but they can mask potential spatial heterogeneity for neighborhoods. So for example, if you apply a county baseline disease rate to an entire neighborhood, you might, or the entire county, you might overestimate the baseline disease in some areas and underestimate it in others. So for our study, we obtained census block group or neighborhood level baseline disease rates. And what we found is when we compared county and neighborhood level baseline disease rates in our health impact function was the census block group yielded a higher median burden of disease, as seen by the box plots. And it also yielded different spatial patterns as compared to the county rates we can see in the maps. So from this, we concluded that without this type of highly resolved neighborhood baseline disease rates, we might not adequately identify disparities in the health burden attributable to air pollution within cities. Thanks. So the other portion of our study was, of course, to compare how the satellite-derived land use regression model compared to our Google Street View dataset. And what we found is that the land use regression model yielded higher estimates of mortality attributable to air pollution, and that was owing to the higher concentrations of the land use regression model. We did also find that the land use regression and the Google Street View yielded fairly similar overall spatial patterns, but the Google Street View dataset was able to identify a larger magnitude of spatial heterogeneity within cities, particularly with hotspots near high-density roadways, such as this is I-880 in Oakland, California. So in this presentation, we've seen how highly resolved spatial data can help public health researchers identify areas within cities that are experiencing higher rates of disease attributable to air pollution. The data sources we explored were satellite-derived concentration estimates, innovative mobile monitoring, and highly resolved baseline disease rates. Particularly, we demonstrated that the county and the more highly resolved baseline disease rates did a good job of letting us see where these disparities within cities exist. So if we don't have that highly resolved baseline data, we might not adequately identify these. So just to kind of bring this all together, at a spring 2019 meeting at the George Washington University, we got together local and state representatives of different governments, and they really emphasized the need for this type of highly localized data in order for them to inform their decision-making on the local level. So it's our hope that this type of local health impact assessment can be used in cities worldwide to help inform local decision-making. So with that, I'd just like to thank our collaborators at the Environmental Defense Fund, University of Texas Austin, Harvard University, the Alameda County Public Health Department, and Oregon State University, and of course the generous funding from the Environmental Defense Fund and NASA for funding our group at the George Washington University.